Hello, everyone. It's Monday, August the 3rd. I hate like crazy to start off with this, but we've lost another individual. We lost a 79-year-old male in Kanawha County, our 117th death in West Virginia. I've also got to report to you and ask for your prayers for this family as well, but we lost a person, a man in our National Guard, a very young person and everything. But anyway, I don't want to get into any more detail than that, but I surely ask for your prayers for all of our guardsmen and ladies that are there and all the great stuff that they do all across this world all the time and all that they've given. For crying out loud, it's been phenomenal just what the work that they've done in regard to this pandemic and in response to that and within West Virginia. But they've always been here for us, and they always do miraculous work, whether it be, the floods or windstorms or whatever it may be, they're always there. And so please keep this family, in your thoughts and prayers, and as well as all of our guards, men and women. But anyway, and please also remember the person that we lost, that 79-year-old male in Kanawha County, our 117th death, and we should continue to pray for all those 117. As far as our numbers go, I've got two things to report. Surely not the good news is we have now had 239 new positive cases reported over the weekend. We have active cases of 1,938 in West Virginia. That's up from Friday's number. We have another 10% increase in our hospitalizations. I've been telling you that our hospitalizations seem to be going up at a level of about 10%, a day or whatever. Over the weekend on Friday, we had 102. Now we've got 116. In Kanawha County, we now have 312 active cases. That's up from 277 on last Monday. But the biggest concern that I have is just this now. And concerns change because we have to be just that. We've got to be fluid in our thinking and be on top of stuff and continue to try to run to the fire in every direction. The biggest concern and worry that I have right at this moment is the migration of this from the South. Now, I've said it, West Virginia, over and over and over and over. If you look at the counties of Mingo and Mercer and Wyoming, those counties right now we're having real issues with. And we absolutely have got to stay, and gosh knows I said Wyoming, I didn't mean to say that. It's Logan, Mingo, and Mercer counties. But those counties right now we are having a real problem with. Where do they border? They border the southern states. They border this migration. We, no question, have problems with people going to Myrtle Beach per se and coming home, maybe not having symptoms, but having this disease, spreading it. We have those problems. We know we got those problems. But absolutely, I caution all West Virginians, especially now those that are in the South of our state, to absolutely take every possible precaution. This terrible killer is moving from the South, and we see it, and we got to stay on our game. Now, from a good news standpoint, West Virginia now has a total positive cases of 6,800. Actually, it's 6,854. Now, just think about this. The states that surround us, Ohio, we have 6,800. Ohio has 93,000. Kentucky has 31,000. Virginia has 92,000. Maryland has 90,000, and Pennsylvania has 113,590. If you look at that, you'd say, my gosh, West Virginia is unbelievable. It's unbelievable good. but we still lost 117 people, and this situation continues to migrate and come right at us. Now, one of the things we're doing from a proactive standpoint is I have directed the DHHR, working in coordination with Thomas Health, to immediately stand up St. Francis Hospital as a COVID surge hospital. Now, we're doing this as a test run to absolutely be ready in every way. Now, this past April, I directed the DHHR, the National Guard, and FEMA to provide the operational plans needed to prepare this facility as a surge hospital. In April, we made that move to be able to have this hospital as a surge hospital, and we are bringing it up online right now. And I want to especially thank the Thomas Health people for their assistance in offering up this facility for our use during this terrible pandemic. Okay, we've got 3 super hot spots that I know about right now, and there's probably going to be more outbreaks, and as that happens, we need to continue to run in every direction we can possibly run. The Princeton facility now has 31 staff and 33 residents that are positive. They have 19 people that are hospitalized. Absolutely, the Princeton situation is not good. Absolutely, we are running additional staff and doing everything. Dr. Amjad was there over the weekend. You know, our people are staying on top of this to the very, very best of all of our abilities and everything. I'll have a report on that in just a few minutes from our medical team and Secretary Crouch. We're also having an outbreak in the Beckley Appalachian Hospital, or Regional Hospital, and at the Logan Regional General Hospital. Yesterday, and again, all of our people have visited these places, and they're staying right on top of it. Through the weekend, we had 1,000 calls and back and forth with all these people, offering up everything from PPE to anything and everything that we can do. We know this situation is with us. We're absolutely trying in every way we possibly can to be absolutely as proactive as we can be. We tested 388 people yesterday in the Logan area, with our free testing, and we continue to offer that up and everything. Any and everybody that has a concern or whatever, please go get tested, and because it only makes us better and better. From the standpoint of our Mon County bars, I extended the closure for 10 more days. I am very hopeful that we'll be able to get back, those businesses on a limited basis. But right now, in the situation that we're in, we just don't need to bring that right back up online today. But I would absolutely encourage the people, the owners of the bars and everything, and those establishments that we're trying to get you back up and going. We ask at what time that would ever happen to please make sure that we have masks and social distancing and all those things. We're trying to get you back up and going, but right now I just don't think that it's, we'll go another 10 days and look at it. Okay, from the standpoint of our churches, we have now outbreaks reported in 4 churches. That's gone down, that's good. That's Mason, Grant, Logan, and Taylor counties. We have outbreaks that account for 89 cases, and I just continue to urge the same thing. A pew in between you, social distancing, wear a mask, wear a mask, wear a mask. Now, while I'm on that, before I go any further on that, I want to just say just this. All across our nation, every health expert, every leader, everybody is saying one thing. We have got to do terrific hygiene and washing our hands. We have got to try every way we possibly can to look out for our elderly and help our neighbors. We absolutely have got to social distance, and we have got to wear our mask. We got to. Nobody likes it, but we got to. And if we don't, it's going to continue to absolutely devastate us in communities. we are going to have to report over and over and over about outbreaks that we have. We're seeing a movement now that this disease is moving into rural areas, areas that maybe we have been a little safer before, and now we're seeing a more of a movement there. Kentucky is covered up with this situation right now. We do not want to become Kentucky. We surely, to God above, don't want to become Florida. You have got, West Virginia, to wear your mask. And I would call upon all of our businesses across our state to please help me in policing your business and try every way you possibly can to see that people are wearing their mask. We don't want to let our guard down there. Please don't let your guard down, West Virginia. And absolutely, if you have someone that has a COPD, problem or whatever it may be, we understand. We understand certain people can't wear a mask because it puts them in more peril. But absolutely, I would tell you just this. If you can't wear a mask and you really legitimately have an issue with doing that from a problem of health, then maybe let someone else run in the store and pick up whatever you need. But we have got to realize the magnitude of what we are addressing here. And so please, please wear your mask. For the small business grants, same thing. We got all kinds of work going on there. It sounds great. We've sent out over 4.4 million. We want to send out 150 million. There's no need to, unless you really want the dollars now, there's no need to rush your application. The application date will stay open until September the 30th, but you must have a vendor number with the state before you can apply. Our people stand ready to talk with you and talk you through this process. Get the money, West Virginians. We really need our small businesses to have this money. You stood with us all through all this tough times and everything. Get the money, West Virginia. All you got to do is apply. Now, the free testing is going on this week in Raleigh, Hampshire, Jackson, McDowell, and Taylor counties. Next week, we'll be in Brooke and Mingo counties. Again, we urge all the residents that have any animosity, any concern, especially those that aren't feeling well, and especially our minorities, come and get tested, West Virginia. It only makes us better. That's all there is to it. As far as our cities and counties on our CARES Act, now get this number. Get this number. Now we have sent out $102 million to our cities and our counties. And we're continuing to do exactly just that. It's 162 cities and counties that have applied so far. We're going to continue to just pump that money out and everything. Continue to apply, and we'll continue to send the money. We've got to follow the guidelines. We've got to follow absolutely what, is the right things that have to be done from the standpoint of the federal government. But just continue to send in your applications, and we'll continue to send out the money. From the summer feeding program, we've got the 696 sites that are up. You've got to absolutely call, if you have a problem or concern, call 211. We'll answer, and we'll direct you to some place where you can go pick up food. We don't need West Virginians hungry anywhere. Now, I remind you again about the census. We need team leaders there. We want team leaders there in every way and everything to be able to make sure that everybody gets counted. The last thing I've got to report to you about is our roads and what's going on there. But we've got road projects, and all this information, will be today. The West Virginia Department of Transportation will be announcing the medical access roads projects, and that's all coming up. And their interactive map will show all these projects. There's projects in all 55 counties, and the DOT coordinated this with the local emergency medical services and the county office of emergency services to vet and prioritize all these projects. And these projects will primarily be going for for paving, for drainage, for slips, for slides, all the different things, that make it difficult for us to be able to travel to emergency condition, in an emergency condition, and all these projects will be announced later today. So West Virginia, you got good things going on. We've still got plenty to worry about. We're going to have to continue to stay light on our feet and move from the standpoint of our numbers. They're not what we want them to be. Our daily rate, if you look at our charts, our daily rate was at 3.18. That's not horrible bad, but it's not as good as it needs to be. We want it under that dotted line. You can see up on top, we're still not separating from the standpoint of active and recovered cases. And down on the bottom, if you'll look at that number, now we are at 2.30. We relaxed all kinds of stuff when that cumulative number went below 3. And now we're at 3.20. West Virginia, don't make this to where we've got to start shutting things down. Our economy in this state's running too good. We just went through a press release on all of that and everything. And a lot of people have done greatness there. And especially you, West Virginia, you have absolutely done. You have weathered this storm and everything. We've still got a long ways to go, but you've done great stuff, and I thank you.
All right, thank you, Governor. Let's now go to Secretary Bill Crouch with the West Virginia DHHR.
Good morning, everyone. Let me talk a minute about Standing Up St. Francis. Governor Justice has directed me to work with Thomas Hospital this weekend to make sure St. Francis has been stood up and ready to go as a COVID surge hospital. Initially, that will be 15 beds prepared and ready to go, and that number could increase as needed as we go forward. In April, St. Francis configured 2 floors and added beds and equipment to serve up to 75 coronavirus patients. That number could increase as well if needed. The Surge Hospital is designed to treat coronavirus patients diagnosed at medical facilities across the state who are primarily in need of active short-term care or rehabilitation services. Transfers will be coordinated through DHHR and the Thomas Health Transfer Center. As the governor always says, we're running to the fire. And in this case, we're running to the fire before there's a fire. We're trying to make sure that we have a backup plan in place to know everything is in place as needed as we move forward. The governor's office, DHHR, the West Virginia National Guard, Federal Emergency Management Agency, and the Army Corps of Engineers assisted in the operational plans needed to prepare St. Francis Hospital to be a surge hospital. If and when St. Francis begins to accept patients, there will be no visitors, but they will provide iPads to allow for scheduled televideo visits. Temperature checks will be done on all individuals entering the facility. All patients arriving must wear a face mask. And you may refer to thomashealth.org for additional information. I want to thank Dan Laufer and Thomas Health System for their efforts and their partnership in this pandemic. This is a huge step in making sure that we are prepared to go forward in fighting this disease. Let me talk just a minute about Princeton Healthcare Center in Mercer County, provide a little bit more information. Overnight, there were 16 individuals who were hospitalized at Princeton. So we have some real concerns. We've been in constant contact with the administration down there, with the CEO. We have 3 reported deaths. As some of you are aware, the Mercer County Health Department is in disarray. We have been in contact with them over the weekend, and Dr. Amjad has made herself available to provide any assistance that might be needed in Mercer County as a result of the changes down there. We have 3 reported deaths, but again, those deaths are reported through the local health department. So we're trying to confirm additional deaths through the health department. We have asked our epidemiologists at the state to provide assistance directly to Princeton Healthcare Center, since we're having and everyone's having difficulty at this point with the changes in the Mercer County Health Department. So they will be working directly with the facility. Dr. Amjad actually visited Princeton Healthcare Center yesterday, made a trip down there. We had telemedicine conference with individuals from West Virginia University, so we want to thank them for their assistance. The National Guard is providing PPE training and airflow studies in the facility, so we're trying to make sure they have adequate PPE and that we look at any possible mitigation efforts that are possible. I've talked about working together and everyone being part of fighting this pandemic. And we have the private sector and our universities stepping up to provide assistance. I was in contact with one of the private operators in West Virginia, who has offered to step up in one of the hospital chains and provide assistance as well. We'll hear more about that later, I'm sure. But I want to thank them for what they're doing. And again, thank the Healthcare Association of West Virginia, who is always cooperative and a great partner in this pandemic. So with that, we will keep you informed. We're trying to provide everything we can provide that Princeton might need to get through this pandemic. They have done a good job trying to protect their patients, but we have an outbreak there that is very serious, and so we're all working together to try to fight that. So thank you very much.
Great, thank you, Secretary. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Good morning. As the governor said, that if you look at our statistics, it's sort of a mixed set of data. And let me just start with saying that Dr. Birx, who works with the White House Coronavirus Task Force, coronavirus. And as we have said the whole time, that this second phase, where we are trying to work and live with the virus, is a much more tricky phase and a much more challenging one. And I think the governor has been very aggressive in looking at mitigation measures, including the executive order for masks, and looking at how we might mitigate more precisely in certain areas of the state, as he mentioned the closure of the bar order in Morgantown. And that's because in Morgantown at one point, 75% of the people that were testing positive in the Mon outbreak were between 18 and 29 years old. And interestingly, in Ohio, the average age of the new number of cases is in the 29 to 38-year-old range. And in Florida, in April, the average age of somebody testing positive for COVID-19 was 65. Today, it's 35. So as we see younger and younger people are starting to drive this, and as we start to look at this novel coronavirus, what we find, and the governor just said this, that wearing masks is so important, but also maintaining physical distancing. That combination is really important, washing your hands and doing all the other things that we know are smart things to reduce the spread. The scary thing is that we are learning that there may be longer term complications of COVID-19 in certain people. And I think articulated last week in a small study from Germany, about 80% of people that had coronavirus about 2.5 months previous showed changes of their heart on heart magnetic resonance imaging, really sophisticated imaging tests. And I don't say that to scare anybody, but I think that we need to really, really underscore to our younger people that this is not just the flu, that we need to pay attention and keep from getting infected because of these potential long-term side effects. Lastly, I'll say that with the outbreak in southern West Virginia, it's very concerning. And this is a part of the state where we see a higher set of risk people related to chronic health issues. And this is starting to coalesce. So very much in the southern part of the state, understanding how we can aid the medical facilities, nursing homes, hospitals that have had problems from spread in their communities, and trying to make sure that we are helping navigate to make it safe for the patients there by, as Dr. Amjad did, assessing those situations, coming and making sure that we are offering support for staffing, looking at making sure that all the patients are getting all of the right treatment, helping create this buddy system with other nursing homes and acute care hospitals, and then also making sure we're doing the appropriate mitigation measures with PPE and cleaning. So these are standards for us. And as we see what's going on in southern West Virginia, these are the kind of problems that we recognized up front that we would have in this phase of COVID-19. So it's really important, West Virginia, for us to reduce community spread, which will help all of these places reduce their problems with COVID-19. So thank you for what you're doing, and we need to continue to double down and do even more.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good morning. As the governor announced, West Virginia National Guard lost Sergeant Jared Collins to a medical emergency. He was 39 years of age and had 22 years of service, so he spent most of his life serving our country. We send our thoughts and prayers to his wife and 2 young children, and we will ensure that we take care of that family. Exceptionally busy weekend, as the governor pointed out. National Guard DHHR support to Princeton, Logan, and a number of different areas, PPE support, subject matter expertise support, as well as assisting first responders who were doing testing. That will continue this week, and will also include support to Beckley Hospital as well. And we'll continue to work and prepare for test lanes coming up this weekend. And we are conducting a number of sanitization missions to include continuing to help Charleston Fire Department, as well as the facilities that Secretary Crouch and others have annotated from this weekend's event. So it will be a significantly busy week for the National Guard this coming week. Thank you.
All right, thank you, General. Dr. Ayn Amjad, our state health officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. I've been talking to some parents, and what they want is some sort of predictability on how this is going to unfold. You had your comeback plan, and that provided some predictability for businesses wanting to reopen. They would like to know, they know that you're shooting for September 8th. They want to know if there is a date before that where you would make a definite decision that September 8th is going to be the day, or if it's going to be a last minute thing.
Well, Paul, all of us are wanting predictability, and I surely understand from the parents' standpoint, they've got to arrange for some level of daycare and whatever like that if we don't go back to school, and we're working hand in hand with the Department of Ed. Superintendent Birch is doing a great job, and I really believe that we're going to have continued announcements as to how we think we're going to be able to do this. I'm going to bring you an announcement on Wednesday that is very significant in regard to this, but it is not yet complete, and I've got some more work that I've got to do with the Department of Ed, and some other players that are in it as well. But I guess from the standpoint, Paul, that more than anything is right now we're waiting on the fourth stimulus, in a way that we're going to be able to use dollars to better make it safer for us to be able to go back to school. There's stuff that's happening nonstop and everything, but I surely understand the need to have some level of guidance and some level of real plan. I am really, really hopeful that we can go back to school, but at the same time, I am completely respectful of everybody's feelings, and absolutely everyone should know. I have said it over and over. You know, as much as I love all those that are involved, no one is going to pressure me on this, and until I am absolutely, positively certain to the best of all of our abilities that we can keep our kids and our teachers and our service personnel safe and everything, it's you know, it's still an open-ended situation, and so we just got to bide our time for just a little while, especially till we see what this forced stimulus thing is about from the U.S. government, because I think they're going to pump into this, you know, at least 105 and as much as maybe $150 billion into some way making our schools and places even safer. So as soon as we know all the pieces of the puzzle, we'll be letting everybody know as soon as we possibly can.
All right, thank you, Paul. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, it's Taylor with the Herald-Dispatch. Do you, Governor, or any of your health experts have any more information about the outbreak at Logan General Hospital and maybe what the cause of that was and if any more people have been identified?
Well, we've had bunches of people at the site, but I think our health experts, you know, can give us a whole lot more detail on that. You know, I've been on the phone 1,000 times with everybody from, you know, in talking about Logan all weekend. But anyway, if Dr. Amjad, or, you know, maybe you'd like to speak about this, or Secretary Krause start us on this, and General Hoyer, you can jump in too.
Would you like to take this one?
Sure, Taylor. From some of our epi data for Logan Regional Hospital, some of it does go back to travel history, and that is what most of our state is seeing. That's why we're talking about travel history being very important. But as far as Logan, going back to some of our epi data, and we're still working on that, some of the cases go back to that, and that's why we are talking about people when they go for their travel history. We want them to have their testing done and to wait for their results to come back in. But that being said, you know, the question goes back to time lag and the test results, but we want to encourage people to wait for those, or to wait for their symptoms to be, you know, abated. But Logan, we're looking at that, as well as some of the staff and as well as some patient data, but it's still very into history. We're still looking into that, so some of that will have to come back, but travel related is that, some patients as well as staff, so it's multifactorial as far as Logan goes right now.
And this is Bill Crouch. You may not have seen this yet. We had a report this morning that there are 22 staff that have tested positive and 5 patients positive at Logan Regional Medical Center. I was on the phone with the CEO 2 or 3 times this weekend. We have provided PPE to them, deep cleaning through the guard. Again, General Hoyer can talk a little bit more about that. They stepped up quickly. There was a meeting at 9 a.m. yesterday morning with the guard to try to provide additional assistance. Drive-through testing was also set up on Saturday for Sunday, and we had a good response down there in terms of the testing lanes. We're also testing some of the nursing homes and assisted living facilities down there as well to make sure that we, again, any positives that we can identify, any positives that are down there. So we're trying to tackle this this county outbreak. It's not just the hospital. There is an outbreak in Logan County that we're moving to tackle as quickly as possible here. So, General Hoyer, you probably have more information on that.
And so, National Guard in support of DHHR and the hospital, the lines of effort that we're supporting are subject matter expertise support related to both PPE use, as well as providing PPE from the stockpile that the governor directed us to maintain. In addition, working with Dr. Amjad and her staff related to additional regional epidemiology support, as well as areas like airflow and other sanitization needs within the hospital. The hospital leadership has brought in some additional infectious disease support as well, and will continue to support first responders who are doing the testing support in the county, as well as analyzing and supporting the nursing home facilities that Secretary Crouch pointed out. Again, all in an effort to mitigate additional spread of the virus.
All right, thank you, Taylor. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I'm wondering if we could get an update now that the small business grants have been sending out money according to what you guys said last week. How many businesses have actually received funds, and what kind of totals are you talking about? $150 million that the governor allocated. So is there an update on the number of businesses which have actually gotten a check cut? How many have applied? How many have been processed? And how much money has been dispersed? Thank you very much.
Okay, Kenny, maybe I can answer that. As of just the other day, when we were here, there'd been right at 2,000 apply. We have predicted that we had a total within the state of about 32,000 of these potential applicants. And that's how we established the 150 million. The other day, I think we had a little in excess of 2,000 or right around 2,000 apply. We have now awarded $4.4 million so far to 881 applicants. And we're working that just as fast as we get the applications in. But just like the cities and everything, it took a little while for everybody to get everything up to snuff and really start really moving. But now the cities have received in excess of $100 million, and our counties. And so we're probably stumbling a little bit from the standpoint of people struggling on how to apply and everything. But we've got 4.4 million in the pipeline that have been awarded to 881 applicants, and I do know that we've gotten in excess of 2,000. I don't know the numbers beyond that.
All right, thanks, Kenny. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers. Dr. Marsh, could you talk a little bit more about the rural aspect? Obviously, Dr. Burks has hit on that real heavy in her comments, talking about how vulnerable rural areas are going to probably be starting now. You talked a little bit about that in your remarks, but I was wondering if you could elaborate a little bit more on that. Thank you.
Dr. Marsh, go.
Okay, thanks, Governor. So, as the pandemic starts, and this is what we saw from Asia, from China, it really emanated across Europe to the eastern side of the United States, and then across the Pacific Ocean to the western part of the United States. And we see, as would be expected, the most highly connected, more cosmopolitan areas where there's a lot of travel, a lot of business, a lot of movement, big hubs in our travel environment, New York City, San Francisco, et cetera. As the disease spreads, and at one point in the eastern part of the country, about 75% of all of the cases were genetically tracked back to New York City. Then people start to pick it up as they travel back and forth. And Google follows cell phone data and looks at mobility based on cell phone data. And we have been very, very mobile over the past few months. And so what happens then, as would be anticipated, and this is what we saw in 1918 as well, the secondary sites that get involved are not only those very connected places, but people carry it back because of travel, because of tourism, because of business, back to other parts of the country that don't have quite the same number of big airports and big business centers. And these are the rural parts of our country. And this is actually something that was predicted even at the beginning. The problem we're seeing right now is that for many people, and this is not an edict, it's just very difficult, but we have had this narrative that young people are protected, that it's no big deal, that most people are fine. But what we're finding is that's really not true at all. And this is a virus that spreads extremely efficiently in people who don't know they even have the disease, spreading it to other people. So we've talked about this R naught or this RT value. Anything over 1 means you're actively spreading. Anything under 1 means you're starting to reduce that spread. And we've just passed down to 0.98. But what happens is it takes about 2 to 3 weeks to see the full ramifications of your RT or your R naught value going up, which we have seen. And now it's starting to come down. We hope that means we'll see some reduction over some time and where we are now. But it is so important right now for everybody who's listening to really take this seriously and stop gathering in crowds, start protecting yourself, start staying physically distanced, wear your mask. And the reason why is because the more we reduce the activity right now, the more benefit we see, not only now, but we see in 3 weeks and 4 weeks. And as the governor has said, we see some of our hospital metrics going up. And as we've looked at, Logan Regional Hospital or some of these other places, it is the staff that are getting sick now, not only the patients, and that is because of the level of community spread. So it is really, really important, West Virginia, to really double down. And this is the part of our state that has the highest likelihood of having much higher death rates because of the pre-existing conditions and the age of the folks that live in the southern part of the state. So it's really important for us to really be cognizant to protect each other.
All right, thank you, Steve. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, everyone. Hi, Governor, and thank you. The cases at the hospitals in Logan and Beckley, are they confined to particular units of those hospitals or spread throughout? And can those hospitals still do the job of community health? Thank you.
Okay. Maybe Dr. Amjad, or Secretary Crouch, someone. This is not my question.
Okay, I can answer the one for Beckley, Bill, if that's okay, and then I went to the Beckley's hospital. But Brad, for Beckley ARH, they had I think 11 staff, and I would say they can still participate in community health because they have enough staff to take care of the hospital and community needs. So they're okay to do that, because they have enough physicians and nurses and CNA, so they'll be okay with that. And it's spread enough throughout because of the community spread that we are seeing, and EPI has been following that in the local health department. So just as Clay or Dr. Marsh had mentioned, it is coming out throughout communities. That's what we're talking about in community spread. But the hospitals are able to take care of the community and take care of the hospital needs because they have enough staff on board. And I think Secretary Crouch had talked to Logan's CEO and Logan's staff to answer that question better. But I had visited Beckley ARH, and because I'm from Beckley, I had talked to the staff and the CEO over the weekend.
Yes, this is Bill Crouch. Yes, had several conversations with Logan Regional Medical Center CEO. They're a Light Point Hospital, and I know he had quite a few communications with the corporate folks. That's a good hospital organization. They're providing assistance from corporate with regard to infection control, potentially additional staffing if they need it. So they seem very much on top of the situation, and I believe they have that under control. Almost every hospital, Brad, and that was a good question, will, I shouldn't say almost, every hospital should locate those COVID positive patients in one unit so that they are they have better infection control. They utilize PPE to a greater degree, and make sure they protect their employees as well as protect other patients in terms of potential spread. So they're on top of this, and I felt very comfortable after speaking with the CEO.
All right, thank you, Brad. Next, we'll go to Sean Stinson with the Pendleton Times.
Yes, this message is actually for Secretary Crouch. Secretary, I wanted to kind of move you away from what was going on in Princeton and back to what transpired in Pendleton County with the positive case at Pendleton Manor. I'm trying to get a timeline from you and your department in regards to that the case was reported to your office on July 15th, but yet the National Guard didn't come here to do the testing until July 20th. Getting some email from the health department here, it appears that Donnie Haynes said on the 15th that he was prepared to come and assist with doing some testing. And like I said, there was a 5-day lag. And I'm trying to get a timeline in regards to this, because I also understand the delegate, Isaac Sponagle, reached out to you in regards to this matter, and just wanted to try to get your thoughts and what's going on with that, what happened with that timeline, that we were able to avoid a situation that's going on in Princeton.
All right, Governor, I'll take this one. Sean, thank you for the question. And first of all, I need to apologize. Delegate Sponagle did reach out, and we actually have some notes. I don't have those in front of me. I apologize for not getting back to you on that. Let me give you, to the best of my recollection, what that was. And I believe that was a late Wednesday. We got that notice. On Thursday, we contacted laboratory, and Donnie Haynes is our incident commander for Health Command, and is very good at making sure that we get back to folks usually the same day with regard to those requests. And my understanding is he did contact laboratory that we use frequently here in Charleston. That laboratory contacted, and there was also contact directly with the nursing home, as I recall. The laboratory contacted I'm sorry, not nursing home. Yes, Pendleton Nursing Home, not the health department. So there was contact back. They agreed to overnight tests to Pendleton facility. And for some reason, those tests did not get overnighted. They went by land or something, or got lost. I don't know the reason they didn't get there, but they didn't get there. My understanding was the contact with the governor's office Sunday morning, and that's when I learned of it. That's the first the governor learned of it, that those tests had not gotten there. We then immediately, I called General Hoyer. I think the governor got immediately on the phone with General Hoyer and said, go take tests to Pendleton. So that time frame in terms of not getting back to them, I think everybody thought those test kits would be there Friday and they could test. They did not make it Friday. When we learned they did not get there, we sent tests through with the Guard. The Guard did the testing. We told Pendleton to keep the tests that had been overnighted, which got there either Sunday evening or Monday morning. So they had plenty of test kits at that point. The Guard carried those tests back, and we got those. We tried to expedite those through the system. So the other thing we did to make sure that didn't happen again, or doesn't happen again, is to put in place a mechanism where if test kits are sent and are supposed to be received at a certain date, we place a follow-up call now with the facility to make sure that those test kits did arrive. So I hope that helps. Again, I should have gotten back to you sooner, and I apologize on that.
All right, thank you, Sean. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Given the fact that we're seeing about a 10% increase in our hospitalizations a day, do we have a projected date at which we'll reach capacity, and how does the opening of St. Francis impact that? Thank you.
Okay, Dr. Marsh or somebody answer that other than I.
Sure, I'm happy to take that. Thanks for the question. So we have a substantial amount of capacity that is existing within our ICUs, our hospitals, and our number of mechanical ventilators. I think that the issue is, as we look at COVID admissions, both in the hospital and the ICU versus total admissions, our hospitals have really activated again to catch up on what people didn't have done during the initial phase of the COVID pandemic. And we work very closely with the West Virginia Hospital Association and all of the providers to get constant feeds on where we are. And as we had demonstrated previously, I think that we, working with the Hospital Association and the hospitals, have learned that if we want to reduce the capacity that we have in the hospitals, we start to reduce elective surgeries, which we don't do immediately because that has very strong consequences on patients being able to get their procedures and sort of the financial status of hospitals with all the people that are employed, et cetera. But we feel comfortable that we have a lot of capacity on the COVID side and that we understand how we can reduce the number of people in beds who are non-COVID patients if we need to do that. One of the advantages of St. Francis at this point are that because of the activity that we're seeing in some of the nursing homes that we've talked about today, that there is oftentimes a hesitation to accept people who are transferred from an acute care hospital back to a nursing home sometimes. So St. Francis could also provide us with an outlet to be able to free up some additional beds, as would be necessary to be able to move people who had COVID and transfer to the acute care hospitals if those nursing homes weren't able to accept them back and transfer.
All right, thank you, Charles. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Governor, on the medical access roads, as I understand the U.S. Treasury directives for using the stimulus money, that seems to strictly limit the use of funding for capital improvement projects to things like establishing temporary medical facilities and so forth. Are we sure if we build these medical access roads with the stimulus money that these projects will be reimbursable?
Well, Phil, what we've done is we've vetted this through every different vehicle that we can find to vet it. But keep in mind this: there was 3 pots of dollars that are out there that the highway people found. One of the pots was in the Roads to Prosperity, and another pot was in I don't really recall exactly what it was. But there was a total of $132 million. And the last 50 of the $132 million was the CARES dollars and all of these projects that made it more accessible to medical facilities for our people. Those are the projects that are going up on the screen and everything. But at the same time, I've got to have confidence in our people. We have checked this, and checked this as to how we can use these funds in regard to this from the standpoint of the medical emergency stuff and everything that we're doing. On the other hand, Phil, I would just say just this, and this is coming. This is just plain coming. You're going to see such a relaxing of the dollars that you have from the standpoint of the potential backfilling, that I absolutely feel 100% confident that, that the vetting of all this, is good that we did, but it really won't be to the magnitude of the necessity as we go forward.
All right, thank you, Phil. Last question today is from David Beard with the Dominion Post.
Hi, the Mon County bar closure extends through the August 13th, and WVU move-in starts 2 days later on the 15th, and then classes start on the 26th. So you've got this perfect springboard for a new outbreak, but it's also kind of a perfect example of having to weigh public health against economics. So what kind of numbers do you need to pretty much just cross your fingers and reopen them and hope for the best, rather than just keep the things closed for the whole semester?
David, I can assure you that, again, this balancing of the whole thing from the standpoint of the economics, I mean, if you're one of those businesses and everything, this is just killing your business and everything. I get that. And from the standpoint of the convenience and everything to our people and everything, our people, for the most part, want this. We're watching the numbers. I'm listening to the health experts in every way. We surely have an issue right at the moment that would not condone, in my opinion, reopening today. But at the same time, I do feel confident that we'll be able to get back and reopen, and we'll have to just be better than we were before. But we're watching those numbers, and you've got to admit, wearing the mask and closing those bars had an impact on those numbers in Mon County. And if we hadn't have done that and everything, it may have really, really gotten away from us. And so we're watching it, and I'm wanting to get them back open as soon as we possibly can. It's just that right at this moment and everything, I don't think it'd be the thing to do.
All right, thanks, David. Governor, I'll turn it back to you.
I would just close with just this. Remember what we said earlier. I said earlier, and I think Dr. Marsh said the same. We're having the biggest concern that I have today is what's going on in our southern counties, because this thing is migrating from the south to us. Now, we're evaluating right now the travel requirements of our people, from the standpoint of should we move to a situation to where if you go out of state, you go to Myrtle Beach, wherever it may be, you come back in the state, we have got to have you quarantine yourself, test yourself, and make sure that you stay quarantined until the test results come back. We have not made that mandatory yet, but that's surely on the table right now. And it's on the table because what we're having here is community outbreaks that we absolutely, this is like a can of night crawlers. When you think you've got them all in the can, you turn around and look, and a whole bunch of them have already crawled out of the can, and you've got different things in different spots because somebody was traveling out of state. They came back, they didn't know they had it, they've given it to 14 people over here and 3 people over here. Just think about this just for a second. We have got 100 positive cases in Logan County. 100. Now, Logan County's population surely is not that significant as far as the total population of this state. We've got 100. It is absolutely ridiculous to have 100 cases in Logan County. And if you've listened to our health experts, a significant, if not the majority, of all of this is driven by Myrtle Beach, out-of-state travel. So we're looking at it. We're going to have to either the numbers are going to have to start coming back our way, or we're going to have to start posing more restrictions on those that travel out of state and then come back. And the last thing I'd say is just this. From the very get-go, from the very, very beginning of this whole thing, Dr. Marsh and I have sat together, and the number one thing that he said to me over and over is, Governor, do you realize that we are in a transformational situation in which our doctors and nurses can get sick, and if we lose them, we will be decades before we'll be able to replace that level of care within our state. Now, today, as I make myself notes as people go ahead and talk, today we are very concerned about staff, whether they may be at the nursing homes or in our hospitals, that are getting sick. And as we lose those people, or those people are sick, we can't cover for the others. So I just say this to you. We've got our PPE, we're in good shape. We were really, really, really concerned about that in the beginning, and all that's good. But absolutely, we have got to keep our health care workers and our staff at these places and everything. We've got to protect them, because we can't take care of our people if we don't have our doctors, we don't have our nursing home staff, we don't have our nurses. We've got to really protect them. So we got a problem. A lot of states would say, you don't have a problem in West Virginia, the numbers are great, but they're not good enough for me. And so let's just keep working at it, West Virginia, and say a bunch of prayers, and we'll just keep moving forward. Thank you so much.